So basically, everyone that has low back pain, if you come in this direction here, you're going to have greater success in turning off that low back pain. At least that's what I've found over the years. And we go up, we go down. I failed to come this way yet. Let's see what we find in this direction. A lot of times coming in this direction, you'll find some good stuff in here. Yes. And I'm not focused on what her face is doing. When a person has tender reflexes, they'll slightly tense their foot. Once they do that, I know I'm on a good area. Let's come over here.
Have you ever found that, going at that speed, that you might miss something?
Not really, because my bites are really tiny, and I overlap and I go over it in different directions. But that's an excellent question. The tinier you make your bites, the better. I used to make these bigger, gaping bites, and I did miss a little more. But with this technique, we're going to get most of it. We're at about 3 minutes and 47 seconds, Peggy, right? Okay, got it. Go ahead, I'm sorry. Go ahead.
Have you ever found a tool that you could use instead of your phone?
The Orientals, such as people in Thailand, they have this little stick that's about that long, but it's hard to master that stick. It really is hard because it takes almost as much effort and fatigue of the hands and the muscles to operate that stick. But it allows you to get into the reflex areas deeper. One of my instructors, we're at about 427. One of my instructors, Lillian Tibshraeny, she was in Thailand, and she had a reflexology treatment from someone who had one of those sticks. She said it was the most painful thing she's ever, more painful than childbirth. But she said for the next several days she felt amazing. She's if she was a poker player on the world tour, I'd have a hard time wondering if she was even alive or not right now, based on what I'm doing. But she doesn't give us a whole lot to go on, other than her feet are slightly. Okay, we're going to stop right there. It's been 5 minutes and 7 seconds. So, Peggy, would you go ahead and let me ask you this: what do your feet feel like right now?
Sore.
Okay. So hers are a little sore, so everyone's allowing to themselves. Would you stand up for a minute?
Actually, it's better because when I was laying on the table,
yeah,
I had like the pressure here, and partway through, that pressure
just went away.
So I noticed that when I was laying on the table when it first went, I had the pressure there, and when you were doing it, it subsided, and it was just like, okay, I can do this.
If a person knows the outcome is going to be positive, in other words, if I spend 5 minutes and she has no back pain for 2 days, is that a good exchange?
Yes.
Now, what's left in your back right now?
Actually, it feels better. I mean, you kind of melted it away, like partially through.
Is it complete? Is your back pain completely gone right now?
Pretty much so, yeah.
No, it either is or isn't.
Yes.
Okay. I want to get specific because we want to remove all doubt. It's completely gone.
Yes.
Okay, good. So she only took 5 minutes and 7 seconds to get rid of her low back pain. Now, why? Rob